And we're live. Hello. Hi, everybody. Welcome back. Happy Sunday. Happy Sunday. How are you doing? I hope you all had a good weekend. You're welcome. I'm Dr. Sylvia, and this is AskAwayHealth, and we're discussing everything that is relevant and relatable about health, women's health, sexual health, everything and anything in between. Right. So today we're talking about menopause. I did promise during the last stream that I was going to be tackling a couple of women's health essentials kind of videos theme around menopause. And what was it we did last week? Was it birth control? Or I think it was birth control. But I'm going to sort of do a few more of these in the next couple of weeks. So please make sure that you stay tuned. It'll be great to have you on board. So hi, how are you doing? Thank you so much for clicking. Please give this video a like. Please like the video. Tells YouTube that we're doing something interesting and quite useful here. So I would really appreciate it if you would click that thumbs up button. And of course, consider subscribing to the channel. And if you're watching from Facebook or LinkedIn, and it's going to take some time for me to get my head around this because I've only just started screaming to those other platforms. You're very much welcome. Please do let me know where you're watching from. It's great to have you here. Okay, so we're going to be talking about menopause, but I also wanted to discuss a sort of slightly menopause related story, which I think will be of interest to us. It's a misdiagnosis situation. And I have been sharing quite a few of these on my channel recently because I think we learn from the experiences of other people, sad though they may be. At least we hear the stories, and perhaps it can put a check as we go on our own health journey, and help us to push deeper, advocate better, ask more questions. So I'm going to share my screen while we look at this story, which I picked up from The Independent earlier today. And I'm just going to read through it. It's not that long, I suppose, but I just want us to read through it together. Hang on a second while I find my place. And then we will just sort of have a discussion, maybe just raise one or two points that I thought were interesting to share with you guys. So let me share the screen. Let me just check that it's visible. Here we go. Okay, so this is a story. Let me read from the main page. Yeah. So this is a story. It says, I developed ovarian cancer after my symptoms were dismissed as menopause. So of course, my ears were pricked. I was like, how did we get from ovarian cancer and menopause? What's the connection? So I don't know how recently this was published, but as you can see, it's from The Independent. Let me just mute this. Yeah, it's from The Independent paper. So let's read the story. So a woman has said her ovarian cancer diagnosis was delayed after her symptoms were wrongly dismissed as menopause or irritable bowel syndrome, IBS, accusing her doctor of misogyny and medically gaslighting her. My goodness, my goodness. Those are heavy accusations, and this is so disappointing. And sadly, remember, if you were there when we were talking about, I did a live stream on the endometriosis. I can't remember the title, but if you check the endometriosis playlist or even the advocating for ourselves, I think I have an advocating for ourselves playlist. It will be on one of those. And we talked about some of the experiences of women when it comes to these things, how they feel dismissed. When I say they, how we feel dismissed, how there is some kind of gaslighting. You don't feel as if you're being heard, listened to and heard, in the sense that somebody hears the words that you're saying and applies them to your context in order to be able to help you make a decision that will help take you forward. That is effective listening, isn't it? That somebody is picking up what you're saying, even what you're not saying, so your non-verbal cues, and then putting that information together and being empathetic with your situation so that you can move forward. Women, there was a survey. It's on Endometriosis UK association website. If I remember, I'll put the link because it really makes for interesting reading. Women are not imagining things. This is experience. So these are heavy accusations, and I'm so sorry that somebody would experience this in her quest for medical health. She just wants to be healthy. So we learned her name, but I don't know if this is a typo. I thought it might be Saba. I'm so sorry if I'm mispronouncing. Please, anybody who knows, correct me. But let's say she's Saba or Miss Sadiq, a 55-year-old business owner, told The Independent that unconscious bias and cultural incompetence were also to blame for her delayed diagnosis. So this is really, really important, this issue of cultural competence amongst healthcare professionals, and being able to acknowledge that you can't treat everyone the same way. We all come from different backgrounds, a diverse plethora of experiences, cultures, and the way you speak to one person to be able to get them comfortable in the consulting room is different, has to be different. You have to appreciate that, you know, people's health seeking behaviors are different, how they interpret information is different. It's different. It's different. And it looks like this wasn't respected in the case of Miss Sadiq. Okay, so let's go on. It says she lives in Berkshire. There's a picture of her down below, but let's read on. She lives in Berkshire. Said she began to feel unwell. So let's pick up her symptoms, okay? And this is recent. This is not something that happened 10 years ago. She began to feel unwell around October 2021, but did not get diagnosed with late stage ovarian cancer until March the following year. So her symptoms started October 2021, but the diagnosis didn't come until March the following year. And at that point, it was already late stage. So she had October, November, December, 6 months really, the following year. She says, I was feeling really tired all the time. So symptom, listen to the symptom, tired all the time. I had no energy. So tired, lack of energy, piling on weight that wasn't there previously, despite not changing my eating habits. I was needing to weigh more. You see, ovarian cancer is not, we really have to put on our awareness hats and be very suspicious, quickly suspicious for ovarian cancer when a woman comes in. And the reason I say that is because, you know, with that location in the abdomen, there are other conditions that may deceive us as clinicians, and we don't pick it up unless you're sort of thinking about it quickly and, you know, putting it into the mix of possibilities. I mean, if you look at the symptoms, tiredness, lack of energy can happen in menopause. Adding weight that wasn't there previously, despite not eating more, can happen in menopause. Women can add weight in menopause. Going to wee more, there is the genitourinary syndrome of menopause, which just means that as a result of something that we're going to talk about in a few minutes on this stream, changes to the genital area, changes to the tissue, and because of the reduction in estrogen and progesterone, can affect even a woman's urinary symptoms. So she might be going to urinate frequently, experience frequent urinary infections. This is related to the reduction in hormones, so it can happen in menopause. So I can see where the symptoms initially may have been considered given her age and so on. I think the problem I have with is what she said at the beginning, where she felt she was not treated right, not listened to, medically gaslighted and so on. I think that's part of the concerns I have. But you can see where the symptoms could fit in with menopause, could fit in with IBS, could even fit in with ovarian cancer as well, which there are no exact specific symptoms. It can be vague symptoms, but you really have to put on your thinking cap and feel you cannot let this woman go, you know, without excluding ovarian cancer. So that will prompt you to do the necessary blood test and request for the scan to have a look at what's going on. So those are her symptoms. So next she says, I was going back and forth with my GP trying to get an appointment. So of course, this was during COVID as well, October 2021. I couldn't get a face-to-face. Every consultation was on the phone or via online forms. That was part of the problem of the misdiagnosis. And she goes on to say her GP was very dismissive of her symptoms and attributed them to IBS or the menopause. At the end of the day, I'm not the expert. The GP is, I believed him. So it says, Ms. Sadiq, co-founder of Asian Star Radio, said she accepted his diagnosis until a routine in-person appointment with her dermatologist who sensed something was wrong. So finally, a clinician saw her. And, you know, I'm an advocate and I support online consultations. I know that they have a place in current medical practice, but not in every instance. And I think if somebody has talked about a set of symptoms once, twice and she's not getting better, then you should be saying, okay, I think it's time to just have a look at you or take a closer look at things. Obviously, we don't have all the information here, please. We're just sort of putting our thinking caps on. In fact, I forgot to use my disclaimer. So let me just put the disclaimer on while we're here. It's a bit late and I apologize, but it's always important that, one, we don't have all the information to hand. That's number one. And number two, of course, we're not trying to diagnose anyone. We're just providing information and education. Really important to bear that in mind. And hello, Waneka, where is this now? Nekat Nebedum. Nice to see you. Hi there. Where are you writing from? Is this YouTube? It is. Hi, where are you watching from? How are you doing? How's your day going? Hope you've had a good weekend. Thank you for joining the stream. So let us carry on with this lady's story. So she accepted the diagnosis until a routine in-person appointment. So she saw her dermatologist who sensed something was wrong. How did the dermatologist sense something was wrong? And so this is a photograph of Miss Sadiq in hospital. So she's had some procedures. Right, it could be any one of us. Okay, so the dermatologist says, are you okay? Your tummy doesn't look right. That's it. So, I'd love more information about this because, anyway, so it depends on what she was seeing the dermatologist for, what skin conditions that she was seeing the dermatologist for that necessitated them to have a look at their tummy. So she says, my tummy looked like I was 6 months pregnant at age 54. I wonder what would have happened if I hadn't seen my dermatologist. I would have believed what my GP was saying. It would have got worse. I would have probably gone in by AID admission. She's not wrong there. She is not wrong. So it says, Miss Sadiq went on to be diagnosed with stage 3 cancer. The stage of the disease, she explained, that comes just before stage 4, which is often terminal. That is true. Stage 3 is late. And she added, as women of color, we are unintentionally disadvantaged. It is a system that is just not designed for someone like me, for a middle-aged woman of color. Doesn't that make you sad to read that? Doesn't that just make you sad? There are unconscious biases at play. The system isn't designed for diverse patients. So we have to keep on picking this. This is not one individual, it's a system that doesn't recognize, that's not designed for someone, for a middle-aged woman of color, that is not culturally competent, doesn't recognize the differences, and not just recognizing differences, actually being respectful enough to a person or to people to understand and listen to their issues and help them forward, like I explained at the beginning. So she says there was unconscious bias, cultural incompetence, medical gaslighting to some extent. It was easier to fob me off and dismiss me as a menopausal woman making a fuss. We have to be careful, us clinicians, doctors, nurses, we have to be careful of those patients that we say are making a fuss. Because maybe they're making a fuss because there's really something serious going on and we need to listen. And it's tricky. It's tricky, but listening to somebody and just trying to understand where they're coming from without making that judgment. I think many people would just like to be going on doing their own thing and going about their day and not coming to sit down with the doctor making a fuss. So it is worthwhile listening. And what exactly is she worried about? What's going on? Ms. Sadiq said it is likely she would have avoided invasive treatment that has now left her with permanent disabilities if her cancer diagnosis had not been delayed. I had IV chemo, 4 rounds through a cannula on the arm, which is probably what she was doing that on that photo that we saw. I did that for 12 weeks. One of the side effects is peripheral neuropathy from damaged nerve endings in the hands and feet. Yes, so that's damaged nerves in your hands and feet. And she says, because of that, I have a lot of pain when walking and sitting. I can't sit on the floor any longer. I can't walk long distances. I can no longer wear high heels. I was extremely active prior to my diagnosis. So these are the huge burden of cancer diagnosis and treatment. Often easier when things are picked up very early before they've allowed to spread, and you have a better fighting chance of treatment that helps to manage the condition, put you into remission, and you can sort of go on to have a fairly normal life after early stage treatment. But by the time it's spread, then the chances of recovery, the chances of experiencing severe side effects, all those things are much, much higher. The IV chemo also caused debilitating fatigue, nausea, vomiting, constipation, and hair loss. She explained how oral, so when she switched on to tablets, chemotherapy tablets, she developed a rash, and that she still suffers from post-traumatic stress disorder as a result of that. So the rash started on my face, it looked like teenage acne. Then it literally spread to my chest and then to my whole body. By this time, it had mutated and its appearance had changed. I was on that medication for 7 weeks. That's the chemotherapy tablets, and was hospitalized 4 times. A&E doctor said the rash was what an acid burn victim would look like. The rash was dry, flaky, red, one, itchy. I would stand up and there'll be a puddle of skin. It's like Stevens Johnson's kind of thing that she's describing here. That's a severe life-threatening, potentially life-threatening, skin problem, and it can develop as a side effect of medication. Anyway, I don't know. Like I said, we don't have, all we have is what she's telling us here. But she was on this she had this very, very serious complication. She explained side effects from the rash caused her to pass out from exhaustion, adding that she was broken physically and mentally. What a shame. What a shame. It is now just over a year since Ms. Sadiq was told she was wholly cancer-free, something she describes as a miracle and attributes to her Muslim faith, keeping her grounded as well as the support of her loved ones. Wonderful. Thank goodness for her. There is no doubt the NHS needs more funding, she concluded. This needs to be sustained and not a sticking plaster, but a long-term policy around cancer care. But there also needs to be systemic change to account for patients' cultural and religious nuances. This is what we're saying about cultural competence. You know your body best. You know what your normal is. And if something doesn't feel right, then go and get it checked. So advocate for yourself. Please speak up. Please speak up. Be persistent. If you're not getting the answer you need, go with somebody to talk to the doctors, look for a second, third, or whatever opinion is needed if you still feel it's not being taken seriously. Janet Lindsay, Chief Executive of Women's Health Charity Wellbeing of Women, warned ovarian cancer is often diagnosed at the late stages when treatments can be less effective, because it's one of those horrible cancers. I mean, they're all horrible, aren't they? But there's no specific early stage symptom that sort of shouts out that, oh, this is probably what this is. So you have to really be looking for it, be conscious and be looking for it. And sometimes the symptoms may mimic other less serious conditions. It's not an excuse, just an explanation, and we should do better. We should work at trying to get better at this. We know that those from ethnic minority backgrounds in the UK require more visits to the GP, have to wait longer for diagnosis, and are often diagnosed with later stage cancers. God have mercy. We know that those from ethnic minority backgrounds in the UK require more visits to the GP. What is it that they're not speaking? What are the problems? This is where we need to focus our interest. Have to wait longer for diagnosis, often diagnosed with later stage cancers. So this is it. This is. Do we have data supporting that? So Ms. Lindsay, whose organization has launched a fundraising campaign for research into the treatment and diagnosis of gynecological cancers, said every year 7,500 women are diagnosed with ovarian cancer in the UK. Around 4,100 die of the disease, which is 11 women each day. There's an urgent need to improve survival. Yeah, we need to get better at this, picking it up earlier. Dr. Victoria Zotzu-Brown, Vice Chair of the Royal College of GPs, said, we want all women, regardless of their background or circumstances, to feel comfortable approaching their GP if they're experiencing any painful or worrying symptoms, and we are always concerned to hear reports of patients not feeling this has been the case. We can't comment on specific cases as we don't have all the details, but the GPs aim to do the best for their patients. We are highly trained and experienced in having open, confidential, and honest conversations working with our patients to come up with the most appropriate treatment plan based on their unique health needs. However, we currently have a severe shortage of GPs, and it's becoming increasingly difficult to give patients the time and safe care they deserve, which is why we are encouraged by the new government's pledge of more funding and support for the family doctor service. So this is the story of Miss Sadiq, and how she was diagnosed with ovarian cancer later than she should have been, and because she thinks that her symptoms were not listened to in a timely fashion, and she thinks it has something to do with her race or her culture. Let me stop sharing. So there's so many lessons to pick up from there. The principal thing I really wanted to address was this thing called safety netting. Let me just leave this to play. So you can see the net over there. And the reason I wanted to share that, it's a net, and I don't know if you can see it very clearly, but it's a net over water. I think it's on a ship or a boat or something. On a ship, I suppose. And one of the things that your GP will do when you come for a consultation, and we're looking at a potential diagnosis, especially when it's not clear, we will give you some safety netting advice. And it's usually information that the GP will give you. It might be related, it might be time bound. They might say, let's do XYZ, and if you're not getting better by a week, then do this. Or it may be, let's do XYZ, I think this is what's going on. And if things start to get worse, for example, if this happens or that happens or that happens, then I'd like you to do this. So it's called safety netting, in the sense that, the doctor has sat down, listened to you, gone through the history and done an examination, and is thinking of a list of possible things it could be. They would consider, well, this is probably the most likely. They start you on that treatment. They haven't done any tests to say that they've confirmed that this is what they're treating you for. And then they provide a safety net. And this is what I worry in this story that we've just listened to. I worry that there wasn't a safety net. I mean, there clearly wasn't an effective examination to help to identify. There was the assumption time after time after time when things were not getting better. So that's the problem. Things were not getting better, and then they stuck to just that diagnosis. When things aren't getting better, then we have to start asking ourselves, well, could something else be going on? And then until you've exhausted all the possible tests to establish that, oh, nothing else is going on, before doing that, really, you can't say that you have fully addressed the person's concerns. So, that was that's a really poor story. But the reason I bring up this misdiagnosis cases, that I share them, and I think they're useful for us to pay attention to, is for learning, so that we can, think what that could have been me, and what could she have done differently. So you can sort of play that in your mind and let that help you make your advocacy, whether it's for yourself or for a friend or a member of your family or so on. Anyway, so that was the first bit I wanted to get away, put that away in the stream. We are talking about menopause, and that is related to menopause, isn't it? If you're just joining, hello, hi, thank you so much for clicking on Menopause Chats. I would like to hear from you. Thank you so much. Let me know what your experience with menopause is. Are you just curious? Are you going through menopause symptoms? Have you got a question around menopause? Remember, I cannot make a diagnosis or treat you on this stream. We are providing health information for the sake of educating ourselves, learning about conditions and so on. If you need specific medical advice, please contact your own doctor. I do have an email health information service. You're very much welcome to use that. Go to my website, askawayhealth.org, scroll down the homepage. Right in the middle, you will see the email service, and we can have a further conversation there. But we're talking about menopause conversations, and I have a few questions for you. If you're here live or you're watching the replay, what do you think? What do you think? Let me grab a drink. My mouth is dry. Okay, hopefully you can hear me. I've unmuted myself. So, how does menopause contribute to anxiety symptoms? What can be done to manage them? I really wanted this to be a conversation, and I hope people will join. or at least share their thoughts in the comment section. But let me give it a shot. So I wanted to address this because anxiety, in fact, mood changes, mood related issues are quite common with menopause. So why? How? I thought we're talking about, you know, female reproductive hormones. Why does it affect your mood? So in menopause, the ovaries' production of estrogen, progesterone, and testosterone, the sex hormones, is reduced. We know that. This also affects the brain. Okay, so it's not just that the production is reduced in the ovaries, it also has an effect on the brain. And this leads to an imbalance of other hormones, particularly the hormones that provoke anxiety, that is cortisol and adrenaline. Those shoot up, while the ones that make us feel comfortable, relaxed, happy, that calm us down, like serotonin and endorphins, the happy hormones, they decrease. That's the problem. So that is why you can be going through the menopause and experience mood changes, and including anxiety. Okay. But in addition to that, in addition to the problem that you have with the hormone imbalance affecting other hormones in the brain, is the fact that because of the imbalance of the estrogen, progesterone, the effect of that on the rest of the body, for example, hot flushes, night sweats, joint aches, night sweats affecting your sleep, memory fog, so many other physical symptoms that happen in menopause also contribute to make you feel less well mentally. So that can increase the stress and anxiety. So you would potentially feel less at your best. So these are some of the reasons why you would have these mood problems. So not only is there a direct effect on the brain hormones, but the other experience, the other symptoms that develop because of menopause, because of the reduced estrogen affecting other parts of the body, contribute to that overall sense of, anxiety. So it's very common, like I said before. There was a study that was done recently with nearly 6,000 women going through menopause and the perimenopause, and nearly 95% of them reported experiencing a negative change in their mood and emotions during the menopause. And guess what? Stress and anxiety were at the top of the list. So please give this video a like. I'm just taking a quick pause to welcome you. I know there are a couple of people sort of hanging around listening, but thank you so much. I appreciate that. But give the video a like, and happy to take any comments or questions around this subject, menopause and anxiety. If you've had this, how bad did it get? What did you experience? I would love to know. But the common symptoms that many women talk about are the feeling of tension, feeling nervous, worried, concerned. You might end up feeling less confident, frequently second guessing yourself, even having panic attacks just out of the blue, panicking and panic attacks, feeling less motivated, not willing to take risks like before. Your general sense of peace or equilibrium is just affected, and women can feel inadequate, incapable, or incompetent. And of course, there could also be physical symptoms like sweating, trembling, like a basket of nerves, breathing very fast, racing heart, and so on. All this could happen in somebody who never ever experienced anxiety, or it could be somebody who did have anxiety before they got into perimenopause and it's become worse. So important to understand, first of all, that this could happen, why it happens, and examples of when it's happening so you can recognize them. And I think for me, what's particularly frustrating, and not just for me, I think, any woman would feel that, it's just that, you've gotten to that stage in life, because the age at which menopause usually happens, we're talking about very late 40s into early 50s commonly. So you're talking about getting to that stage in life where most women would probably have gotten a grasp on their life, career, or business. Things are finally sort of falling into place, or they have done for some time, and you're just trying to enjoy things now, enjoy steering things forward. Kids growing or are off and doing their own thing, so you've got more time for yourself and your partner or husband, or or you might even have come out of a relationship and you're just wanting to do things. That sense of having discovered yourself, that you've come to that age where you've picked up experience from your 20s and 30s, and this is the time where that experience is now able to drive you forward. You're able to do things because you know that you've done this, you've done that before, you've got the t-shirt, and you know not to take a step in the wrong direction. And this is the time when you should really be enjoying the power of that experience. You're leading in your own life, and then menopause knocks at the door. So I think that's frustrating for many women. Anyway, let's talk about what you can do about it, because yes, these are troublesome symptoms, but can you do anything? Absolutely. A lot of things can be done. Starting off the bat, you can help yourself. I'm going to say this a couple of times, but it's a staple really for ensuring that we're living healthy lives. It's not just about medication, it's about the complete person. So proper nutrition and healthy eating, cutting out processed food and sugars and alcohol, making sure that you get regular exercise of whatever form, whatever form of exercise. We talked about how there's an imbalance of the happy hormones, endorphins. Exercise helps to build that up, helps to excuse me, exercise would help to increase those levels of your happy hormones, so that would help. And of course, sleep is so important. If you don't sleep regularly, you're just giving your cortisol excuse to just shoot straight up, and cortisol is the stress hormone. Look at stress management techniques. Find some that you're good at performing, or that you're happy to practice. Could be mindfulness techniques, so it's worthwhile checking out some of those. Relaxation exercises or meditating. Those are ways to just sort of calm yourself. Look for take self-care days, take self-care moments. Tell the people at home that this is my time, if possible. Delegate activities or delegate tasks to free up time for yourself, things like that. And then consider getting professional help. Speak to your doctor. Could look at therapy, support groups, and of course there is room for medication, which can include hormone replacement therapy. There could be some people who don't want to go down the route of HRT. There could be alternatives that could help. So the key thing really is that there are options, there are ways to move forward with this and to get better. So this is how I think we can answer that question. How does menopause contribute to anxiety symptoms, and what can be done to manage them? So let's take a quick break, and I'll come back with the next question. Okay, so we're back. We've just been dealing with one of our menopause conversation topics today. That was anxiety, and now we're going to be looking at atrophic vaginitis. And here is the question. If you're just joining, hi, welcome. Having a conversation around menopause symptoms. If you want to join in, please say hi in the chat and let me know what you think. What's your question? But yeah, so I'm thinking, what are the signs of atrophic vaginitis during menopause? Sorry, I thought I was going to sneeze. Okay, let's start again. What are the signs of atrophic vaginitis during menopause, and what treatments are available? So what do you think? What is atrophic vaginitis? Who wants to answer that? And why do I have the picture of an orange, or is it grapefruit? Who wants to think about that? So let me know what you guys think, especially if you're watching the replay. Okay, so atrophic vaginitis, let's talk about what that is. And that's the reason I have a nice juicy fruit. So it is when tissues of the vagina become thinner and lose their usual plumpness and natural elasticity. So I want you to keep in mind that when the balance of hormones is normal, as you expect before the onset of perimenopause, you'd expect the tissues of the vulva, vagina, the genital area to be plump, nicely lubricated, fleshy, thick, not dry, all those words. Similar to what I've got on the screen. That's why I've got that fruit there indicating, what it's, when the hormone balance is right, that's what you'd expect. However, as the hormone balance changes, as the imbalance begins, then the tissues of the vagina become thinner and lose that plumpness and natural elasticity. And that's because of the less reduction in estrogen and progesterone. So women, we could experience dryness of the vagina, the vulva area, itching, discomfort. There's a sneeze somewhere, it's just not coming. I just have that tickle in my nose. I'm sorry, guys. There's a tickle in my nostril. Okay, so you could have vaginal dryness, itching, discomfort during sex, and urinary issues. I do have videos on my channel talking about this. So please have a look. Where I talk about painful sex around menopause, and treatments as well. But I just wanted to provide an overview, and this is another fairly common complaint that women have, sometimes difficult to discuss with their doctor, and traditionally something that women will just endure, which is sad because they can be treated with both hormone and non-hormone options. In fact, there are so many different options. So I think it's really important about having that conversation, that this is happening for a reason as we go into that period of our lives, but there is something that we can use to treat it. It can cause bleeding during sex or after sex because the tissues are so sensitive, can cause irritation. Women can experience frequent infections. So really important that you're speaking to your doctor about it. How can you improve things, or how can you help things? How can we manage this problem? You can start with as simple as making sure that you're drinking plenty of fluids and staying well hydrated. Okay, because if your tissues are well hydrated, then they're less likely to be dry. They're less likely to have that appearance of, of being thin. At least you're improving your chances. It's better to make sure you're taking plenty of water so you're not dry. Make that conscious effort. If you're somebody who doesn't drink much, then really, as you get into that sort of age where you're perimenopausal, you should be thinking about making sure you're drinking plenty of water. The other thing I would say is also avoiding certain type of products that could irritate your skin. And I think at that point, many women would have gotten to the stage where they know their bodies, they know what kind of creams or soaps they can use that they can tolerate. So just be careful that you're not exposing yourself to bubble baths or douches or personal care products that could irritate the skin of your genitals, particularly the vulva and the vagina. So if you notice any of them that are not good for you, avoid them because they could just make a bad situation worse. So of course, you can also get things like vaginal moisturizers and lubricants. They're not just for the sake of when you want to have sex. They're also some of them are also quite helpful in improving the fluid balance, the state of hydration of those tissues and making them less dry. So another reason to have a look at those options because they're available. And I will put a link to my videos where I actually break down vaginal moisturizers, vaginal lubricants, HRT, different options for treating atrophic vaginitis, particularly around issues with sex. So, of course, HRT, and in this case, we're talking about things like vaginal estrogen. So this is estrogen that is applied vaginally using applicators, or it could be other ways of introducing the estrogen into the vagina. Also, hormone replacement therapy that you can take as a tablet, or you can apply over the skin as a patch or gel. Could help if you're also experiencing symptoms like hot flushes and night sweats, in addition to experiencing changes down below around the genital area. And of course, you can have this conversation with your doctor for the options. So the key thing I think over this is know the signs. The signs are itching of the vulva, or around the vulva, the vagina, experiencing dryness in that area, pain during sex. Those are reasons that you can come to your doctor to speak about those symptoms. There are treatments available to relieve you, to give you a sense of well-being that every woman deserves to have. So guys, we're talking about menopause. We're looking at different aspects of menopause. I'm thinking that we might have this kind of conversation, this series for some time, where we'll try and tackle some common questions that I come across. And if you're just joining, thank you so much. Please give this video a like and consider subscribing to the channel. Any comments you have, always welcome. Let's go on to the third one of the evening, but let's just take a quick break because I want to see if that sneeze is going to come or not. It hasn't come. This sneeze has not come. Okay, let's move on. So we're talking about now, this is my next question for you. What are the early signs of perimenopause and how can they be managed effectively? Let me remove the banner for those that will say, I was covering the question. Here you go. What are the early signs of perimenopause? How can they be managed effectively? So people, sometimes get, confused about this, issue. What is perimenopause? Postmenopause, menopause, which is which? What are you talking about? So perimenopause sometimes is something that sometimes it's as if we make a retrospective diagnosis, because it's actually happened and then we can say, oh, okay, so that was when perimenopause was going on. Let me explain what I mean. So let me just share this with you. So I'd like you to keep your eyes on the screen while I explain this. So you can see a sort of little phase of a woman's menstrual pattern coming from this corner where I've written normal, and you can see the 3 bars here just indicating regular periods. Okay, then after normal you get to what I've called perimenopause, and you can see that the bars are shorter, indicating some change with the periods, and they don't seem to be regular. They've lost their sort of regular pattern, different to what it was. Then you've got the black here, which tells you that there is no more period, and then postmenopause. So let me explain. What is going on here. Bear with me a second. Okay, so for example, okay, let's say you become menopausal on the 5th of January 2024. Let us say that is the day you become menopausal. What does that mean? It means that your very last menstrual period happened on the 5th of January 2023. So that means you've had 12 consecutive months without a period. That is why we can say, oh, okay, you're menopausal on the 5th of January. By the next day, 6th of January, you're now postmenopausal. Okay, so that's menopausal and that's postmenopausal. Now, when did you have perimenopause is the question. So basically, perimenopause is all that time before the 5th of January, all that time. Even when you stopped periods, even when you were having irregular periods, once you started to have irregular periods, so once there was that change from the normal, and it was probably a very subtle change, it's probably something that you may not really pay attention to it. And apart from periods, there's some other subtle signs, because this thing doesn't just hit you like a ton of bricks, boom, like that. Perimenopause is here. No, it's you may not be able to put your finger on it, and that's why I say sometimes it's retrospective, because you may not really realize what's going on unless you're having really full-blown symptoms, hot flushes. Those tend to come a bit later on. But in some women, they can start, they can begin fairly early with you still having your periods. So the perimenopause is simply the time when these symptoms of menopause, they begin to some degree or the other. Your periods haven't stopped. You're still having periods, and they then start to get irregular. You may start to experience other menopause symptoms. Things like the hot flushes, the night sweats might happen. They may not occur regularly. You may have mood swings, changes in your desire for sex. Trouble with sleep might happen. Some women experience changes to their heartbeat. They begin to experience palpitations when their heartbeat they notice it more. You may have headaches, joint pain and muscle aches and stiffness, weight gain or difficulty shifting weight. Changes to the skin, like dry skin or itchy skin. We've just talked about vaginal dryness and itching and painful sex. keep getting frequent infections, so many different things that could happen in menopause. So they could begin around that perimenopause. You haven't reached menopause, you're still having periods. But those symptoms could begin and they may be infrequent, not happening regularly, but they're just there. And you may not even pick up on them immediately to be able to put it all together until afterwards when they're a bit more established or you've stopped having your periods, and then you realize, okay, this thing actually started 4, 5, 6 years ago, but I didn't realize. And that's what perimenopause is. Now remember, because you're still having periods, pregnancy is possible. Pregnancy is still possible, so let's just be aware of that. It will still be possible until you have reached menopause and postmenopause. So you've actually had 12 good months without a menstrual cycle. So what is it that you can do to help yourself? How can you, because let's go back to our question on this one. How can you manage perimenopause? Can you do anything about them? If you're able to recognize and catch that, oh, this is something that is happening, I think a good way to go about it is to track your symptoms. So keeping a symptom diary. Because these things are so irregular. But if you are aware of those symptoms that I've just mentioned, and then you start experiencing something like that, and you're making a note of when it happens, you may be able to figure out, oh, wow, this is what brings it on, or is when I experience this, that this happens, or when I go out, that this happens, or this seems to happen every so often. That might help to identify. But, the next thing that's really useful is, as I said at the beginning, the lifestyle changes. It is so important, especially when you're looking after menopause. It's a phase of life. Some women are happy to go through it without much of a stumble. They don't hardly experience any problems. They're just fine. But other women do not share that experience. But it's important to look at what you're eating. This is a time to make sure your diet is full of healthy food options. Cut down on processed foods and sugars as much as you can. Avoid excess alcohol. Some exercise if you can. That will help with your joints. Lifting weights, very good to help with muscle and joints, especially as you get into the menopause, and to help with controlling your weight. If it's swimming or if it's walking or whatever you enjoy doing, regular exercise is really good. And I cannot overemphasize the benefit of sleep. I know that because I struggle with sleep, and I know that I'm more stressed when I've not slept properly. So sleep is so important. Of course, managing stress, you're having planned spa days, time with family or friends. Of course, things like yoga, meditation, relaxation exercises, mindfulness, meditation. Speak with your doctor. Okay, speak with your doctor when you've tried these things and they don't seem to be helping. You feel they've not made a difference. Have a conversation with your doctor, because yes, there's HRT, but there are also non-HRT options that could help to manage your symptom. The reason that we would offer HRT is because the studies indicate that it has the best effect on especially symptoms like hot flushes and night sweats. Hormone replacement does show a very high degree of effectiveness in tackling those symptoms. And yes, of course, there is a concern about the potential side effects, and that should be discussed and placed into context with your own medical background, your personal medical history, your family history. That is a conversation to have with your doctor. Right, so these are the menopause questions I had for us to converse about today. I hope that you found that useful. I hope we can continue having this conversation in the chat, especially, or in the comment section, especially for you watching on replay. I would really appreciate it if you would give this video a like. And there's so many reasons to subscribe to this channel. Let me share my screen. Let me show you what we're doing. Hang on, let me just show you what else that we're doing and what we've been doing, to show you why. If you haven't subscribed to this channel, what are you waiting for? What's keeping you? What we're waiting for you. What's keeping you? Oh gosh. Let me share my screen with you guys. I just appreciate you joining me today. Start of a new week. So we started the week off very, very nicely. So yeah, here's my channel. Women's health is something I'm really interested in, but also that dives into other aspects of not just women, men's health, children's health, and sexual and reproductive health education. I'm really interested in those things, asking questions around how we can be healthier. So I've got menopause playlist, I've got PCOS playlist, I do questions around pregnancy. I do questions around birth control, fibroids, endometriosis. And, I've started to do these things around diagnosis and misdiagnosis and missed diagnosis and so on. So there is something in there that I'm sure you'll be interested in. I'd love for you to hop on the channel, have a look at some of the videos, let me know what you think. And yeah, let me know in the comment section. All right, guys, this is where we call it a night. Thank you so very much for watching. I really appreciate you spending time with me. Thank you so much for responding to the polls and the questions on the community posts. I enjoy putting those things out, and I'm so glad that many people respond to that. And yeah, guys, please do keep doing them. And I sometimes get them from the questions I get on the channel. When I read a question, I think, do you know what? There may be some other people that actually want to know the answer to this question. It goes on a poll. So that's one source of inspiration for my polls. But yeah, I enjoy doing them, and I'm so glad that people respond to them, and that tells me that you enjoy doing them as well. So thank you so much. Every time you click on a poll, you answer a question. I really appreciate it. Okay, have a great week. Look after yourselves, and I'll see you again soon. Bye-bye.